Hi, Alex.
Hi.
I'm Brittany. I'm a physical therapist here.
Nice to meet you.
So, what brings you in today?
I had a slap 2 lesion repair 4 weeks ago.
Okay. So, what was happening before you got your surgery?
Well, I've always been told that I have a pretty chronic, unstable shoulder,
Okay.
actually in both shoulders, but I'm a volleyball player. In high school, I was a volleyball player, and I would serve with my right hand,
Mm-hmm.
my real passion is golf,
Oh, okay.
and I also golf right-handed, and yeah, so that's what happened.
Okay. And what were you like before? Like, were you exercising or?
Yeah, I used to. Before I started med, I'm a student, I would
Okay.
exercise 3 to 4 times a week, and I would really like to get back to doing that, but obviously I want to be safe. I don't want to have another surgery.
So you're in med school. Do you live with your parents or do you live alone?
I live alone.
Alone. And have you been getting around fine with your arm post-surgically? Yeah.
Yeah.
It's all been good?
Yeah, I haven't struggled too much. It's getting, annoying not to be able to do as much.
Yeah.
So, what is Brittany, the physical therapist, going to do with Alex? Overall, she found that she has quite a few problems. Of course, being in a sling for 4 weeks, she has some decreased strength in her shoulder abductor, shoulder flexor muscles, shoulder extensors. So we want to try and work on increasing that overall strength of her shoulder to a grade 5, which would be normal. Next, we want to focus on that decreased range of motion. She has a pretty limited internal and external rotation and shoulder flexion. So our overall goal is going to be getting to the normal values of around 70 to 90 for internal and external rotation and getting shoulder flexion to over about 150, ideally up to 180. Next, we really want to focus on trying to manage any pain. Within about 3 to 5 months, we want to make sure that our active and passive range of motion is completely pain-free. Finally, we just want to work on protecting that shoulder from any further damage. We want to make sure that we're really stretching and getting a good tissue extensibility on that posterior capsule, but also really strengthening the whole rotator cuff to make sure we get some anterior stability.
All right, so treatment philosophy. So basically our goals is that we want to increase her range of motion and strength progressively in a safe manner. And we want to focus on her quality of movement and specificity of exercises to what her goals are. We want to find exercises that target the muscles and movements related to her sport, as well as injury, preventing re-injury. Millet et al. Describes how it is critical for golfers to engage in a strengthening program to ensure scapular stabilization and protect the shoulder from further injuries, and that's what we want to go through with. And a large part of the philosophy is tailoring the program to the client. We know she's busy during school, so the beginning phases will focus on exercises that can be completed at home using resistance bands, then moving on to getting Alex back in shape in the gym like she used to. Cools et al. Describes the movements that are specific to slap lesion rehab, so these movements were the ones we included within the exercises chosen for our prescription.
So this right here is phase number 1. Mansky et al.'s article incorporated multiple study findings to outline a rehab protocol following a slap repair. So you can screenshot this table here if you want, or pause it and look over it before we start the exercises coming up right away here. Interesting to note is numerous articles stated that there is no gold standard for rehab prescription post slap repair. These internal rotation stretches are important to include as they stretch the posterior capsule, which will decrease anterior shear, as noted by our article by Mansky et al. Exercise intensity should generally be between 1 or 2 out of 10 RPE at this stage. Okay, so this is phase number 2. Again, you can pause the video here if you like and look at it. Young et al.'s article describes the importance in the early stages of rehab to work on scapular stability, rotator cuff strength, and bicep strength, before the 10th week, and of course before you go into more compound strengthening exercises up until returning to sports. This is what we try to focus on in this phase in preparation of the following strength building phases. So you'll see a lot more strength building in the next stage. Okay, so here's our first exercise. That's a D2 that could be progressed into a resistance band as tolerated. There's your scaption. These exercises at this stage should be performed at an RPE of about 4 to 5 out of 10 intensity. At week 10 is when we can start loading the biceps, as you'll see soon here. So right here she has one knee up to work out her core, might as well for core stability. So as you can see here, we added resistance, isometric shoulder rotation first, and then now an actual concentric and eccentric shoulder rotation. And right there is where you have the press. So that's anti-rotation press. So the core is very engaged here, as well as the shoulders, of course, the pecs. A lot of shoulder stabilization is happening here, as well as proximal stabilization from the core. Alright, so moving on to phase number 3. Again, you can pause the video and look at it if you like. The goal here is to increase muscle strength throughout full range of motion and regain strength in the biceps. At this phase, according to the article by Mensky et al., Alex should actually achieve full unrestricted and pain-free range of motion. So the focus here is on developing upper extremity muscle strength, more specifically the muscles used in playing golf, as well as shoulder stability. She should be working on a RPE scale of about 6 or 7 out of 10, so sub-maximal while she's doing this. As you can see, she's enjoying her program, big smile on her face. The reason it's an RPE of 6 to 7 out of 10 is because we want to progress her strength appropriately and prepare her for the following stage, stage number 4, which is an actual strengthening, full strengthening phase. So that's the phase we've all been looking forward to, is stage number 4. So as you can see, we progressed her scaption to weighted scaption, and that should increase stability and strength of the shoulder as well. And moving on to stage number 5. So in this stage, what we're trying to do is enhance strength, of course maintain the range, and enhance power and endurance of the rotator cuff muscles, as well as the scapulothoracic muscles, basically getting her ready for the next stage, which will be the return to activity phase. So these are going to be compound movements, as you can see, and the RPE here should be fairly high, about 7 or 8, possibly 9, and it should be challenging for sure. She should be resting 2 to 3 minutes in between sets to give her body adequate time to recover, and also considering the fact that she's a student, she can't be wasting too much time at the gym. These compound pressing movements are given in accordance with the thrower's 10 protocol by Wilk et al., and they utilize multiple muscles of the shoulder and actually throughout the body in the case of standing. So instead of prescribing 10 different exercises, these compound movements were utilized because they involve scapular stabilization, and it's a more time-effective manner. We're also focused on improving muscular endurance of the rotator cuff muscles, which these exercises also achieve. Now these internal and external rotations done in standing are actually very effective at strengthening the rotator cuff muscles, according to a study by Escamilla et al., as these movements create a significant muscle activation on an EMG of supraspinatus, infraspinatus, teres minor, and subscapularis. It's important for her to maintain that dynamic stability of her glenohumeral joint. And finally, these lat pull downs were given because considering where the muscles utilized originate and insert, as well as biceps, also a little bit of the long head is activated, so that's more stabilization of the shoulder. So it's a good global stabilizer. So finally, the goals of stage 5 are maintaining full active and passive range of motion, maintaining full strength, as well as endurance, and returning her to unrestricted sports activity. So in this case, golf. Golf swings should be performed at a lower RPE of about 3 to 5 out of 10, moderate intensity, and other exercises such as the push-up should be performed at an RPE of about 8. Push-ups on farmer's carries are performed. Farmer's carries are in a variety of progressions depending on Alex's skill and activity level. And Reynolds et al. Describes a return to sport program for golfers recovering from shoulder injury. And that actually involves pressing motions, such as this push-up here. And we chose the push-up because involves a lot of core strength and stabilization as well. So as you guys saw, since the beginning of the program, we've been starting slow and then progressively overloading. It's really important in the beginning to start slow as we did, because you want to develop neuromuscular control. So you actually want to train the brain to move the body in a proper way so that you're using proper mechanics. And at the same time, proximal stabilization. So what that means is you're stabilizing the essential, the core as people call it, as you're moving the peripheral, so as you're moving the shoulder. And then the last point is addressing range of motion. Over time, you want to get more and more range of motion. So as you saw, we progressed her from 60 to 90 to possibly even more. If we can get her to 180, that's the ultimate goal. And it's obviously important to consider what doctors say, what the patient's physicians say, and what the surgeon says. However, once you get to know the patient more and more and build that rapport and know what they do from their day-to-day life and how they're living and what their passions are, you can actually make up exercises to help them get back into whatever they want to do so that they can live that fulfilling life and do what they want to do and what they're passionate about. So as a physio, you're literally bringing life back to people, making people live a happy life again, not just having them do random motions. Thank you for watching. Like the video. Take care, guys.